Hi, everyone, and welcome to Teach About Speech. My name is Mia Terry, and today I am joined with Heather Vukelich of Happy Kids Therapy in Danville. Hi, Heather.
Hi, thank you for having me. This is such a great idea.
Yeah, absolutely. Do you want to go ahead and introduce yourself?
Yes, totally. So my name is Heather Vukelich, and I am a speech language pathologist, and I've been a speech path for almost 20 years now. I got my degree at Gallaudet University in Washington, D.C., which is a school for the deaf. And they have a graduate program where you can study deaf-related fields, and speech path is one of them. So fast forward 20 years, I don't do much with the deaf population, but I loved my time there. I did gain a lot of sign language knowledge, which I use now. And now what I predominantly do is I work with children with Down syndrome. So that's my passion. It has bred into my specialty. And my specialty is working with the muscles in the mouth. It's called oral motor therapy or oral placement therapy. I work on muscles as they pertain to feeding development and to speech development. And as you'll learn in all of your classes that you take going forward, you will learn how all these things relate. And it's very much my passion to help teach parents to help their children learn to eat and speak better so that, they can be more independent. And so I'm really happy that Mia had me here today, because this is like a very large underserved area where we need lots of therapists who can be passionate and empathetic and patient with this population.
Absolutely. And then to go off that, what makes working in the field of or working with the community of Down syndrome connection individuals or people with Down syndrome so important in the speech language pathology climate?
Well, children are, I don't really know the statistics of Down syndrome anymore. It's so funny, but there are many, many children born with Down syndrome every year. And they are just, if you've never known a child with Down syndrome, then you're missing out. So children with Down syndrome are very special, and they bring a lot of light to the world, and they teach us a lot. And I always like to tell the story of when I was growing up and when I went to elementary school here in Northern California. We had a special education classroom at my school. And during recess, I found that classroom and I was very intrigued by those children. And so that teacher included me into that classroom. And I always like to say that inclusion works in so many different ways. So she included me into their world, and that really opened my eyes to children with Down syndrome, children with various special needs, anybody with differences. And it really formed me as a child and as a growing adult. And so people with Down syndrome are, they need a lot of therapy. They have low muscle tone and low strength, and a lot of times differences in sensation. So it's hard for them to feel, to move, to activate muscles. And so what we do as therapists, whether you're a speech therapist or an occupational therapist or a physical therapist, we all work with the Down syndrome population. We help our children to move their muscles, fire them for the necessary goals that we have in mind. So for me, mine are chewing and drinking and speaking, blowing, all the things that we do every day. And then maybe for an OT, it would be working with your hands or sensory integration. And then for a PT, it could be walking, sitting, doing all the things necessary for development.
That's awesome. I really love how you kind of almost fell into the field. It was kind of a part of your path and your journey. And the way you started out is just it hits so close to home for me. And it is really inspiring. And I think a lot of other students can really relate to that and aspire to be that.
I hope so. I feel like people know other people with siblings, maybe with Down syndrome or special needs, and you really see the affect of that child in those families. And I love working with families. I think part of being a speech pathologist, at least with pediatrics, is really having close relationships with families. And if that's who you are and if you like close relationships with people, and especially in the special needs population, you have long-term relationships with these families, because therapy often can last a while, or it can also be cyclical, where a family will see you for a while and then maybe they'll stop for various reasons, and then they'll see you again when their child's a bit older and they'll stop. And so you get to, if you're lucky, know families for long periods of time and be part of their lives. And you also see how those children with special needs affect their community and their family, right? Many of the siblings of the children with special needs that I serve grow up to be these incredibly dynamic and empathetic professionals and people. And you see them in our world. You see them as speech pathologists, audiologists, social workers, therapists, because of that child, their sibling that has, those amazing effects that they've had on their family. And it's pretty incredible. It's a pretty incredible field to work in.
I imagine it's just so rewarding at the end of the day. I'm sure there's plenty of ups and downs along the journey, but the rewarding, it just sounds so amazing and incredible to be a part of something in the bigger picture to impact someone's life like that.
It is. And I like how you talk about ups and downs. I think that there are a lot of ups, especially if this is an area that you feel very passionate and comfortable in, is maybe just helping people. A lot of people, I think, come into our profession because they want to help. And I think that's a good reason. Some of maybe the hardships that you'll find in this is that parents carry a lot of stress for their children. And I am a parent. I do not have a child with special needs, but once I became a parent, I started seeing my clients a bit differently and seeing their struggles and really diving into what's going on at home and understanding the dynamics of parents a little bit more and what they're going through. And so in adjusting maybe the homework I'm giving at home to be more part of their daily routine, or maybe a little bit less than I was giving before. Because what happens is that stress of those parents, it's put on you. And it's just shared. And so sometimes that can be heavy. And so I think that can maybe be one of those things that when you're thinking about this job, it's one of those hardships sometimes you can take on other people's stress.
Absolutely.
Mhm.
Absolutely.
Mhm.
And being able to sympathize that as a parent, but I know you don't have a child with special needs, like you
Right.
said, but being able to sympathize on that deeper level can really, I'm sure, create connection with your clients and your patients and be able to serve them better. But while we're on the topic of routine, what's kind of your daily routine or a day in the life of Heather?
Yeah. So a day in the life of Heather has changed since COVID, but what I used to do before COVID was I would just see children hour after hour. So my sessions are 50 minutes, and my day is like a 10 to 5, and I work for myself. So I decide what that looks like, which is, for me, was really nice for me. I worked for other
Absolutely.
people in the beginning, and then you kind of make your friends, learn how to collaborate, learn the profession. And then after that, I went out on my own. So my own day looks like just blocks. So I just see child at 10, child at 11, child at 12, and you decide how many children that you want to see every day, or how many clients. And my day always includes parents in a session. I think that's really the utmost importance, because what you're doing is you're really a consultant, and you're consulting on the progress that parent has made at home because of the therapeutic intervention you've given them, their homework from the week before. So they come in and they say, I did your homework, and these were my struggles and these were my gains. And you watch that parent work with that child, and then you push in a little bit and you help them make it better. And you're just continuously making it better and better, whether that be better feeding, better speech, better whatever it is, whatever goals that you have. And so that's what I do. And at the end of that speech session, after the parent and I have worked with that child, the parent and I talk, and we talk about, okay, what's your homework for this week? And I've written it all down for them. I take notes and I just photocopy it for them and I send it home with them. And some weeks they come back and they say, we didn't do anything this week. And I say, that's okay. That's just life. And it's just important for you to tell me what's going on so that I know how fast or how slowly your child is progressing and why it's happening. Do you need more support from me, or is it not related to me? So a day in my life looks like that. I am constantly consulting with parents, and then I am praising them for all the good they're doing. I'm giving them a few areas that I see that are easy for them to work on with their child, where they're connecting and they can do it and it's positive. And I'm sending it home and having them bring it back and report back. And that's what my day-to-day looked like before COVID. During COVID, now I sit on a screen for part of my day, or I could also see children in person. So it's both, and I love both. And because the kids on my screen, they could be all over California. They don't have to just be right in my area, so I can see and reach more people. I also have expanded more by teaching. So I get to reach multitudes of parents all over the world. And some of the classes I teach, I get to do that. And so we can talk about teaching later or not or whatever, but I really, really enjoy being able to help people one-on-one, because you're really changing one child's life. But I also love being able to reach 30 parents at one time and professionals combined, so that you can reach way more of the masses too.
Absolutely. And I love the personalization of your practice, like really making a personalized, almost like fitness plan, not really, but making a personalized plan for each of your clients and each of your patients to really expand, and then supporting them through that process and making sure parents are involved and everything like that is so important, and really is wonderful to see, because I know there can be that disconnect sometime between parent and child and being on the same page and working towards that common goal. So to have that as a daily part of your practice is so important. And then I'd love to talk about your feeding classes.
Okay.
So if you don't mind talking a bit more about the importance of feeding in the Down syndrome community, and what have you done or what have you explored in that specialty to kind of reach a further footprint of people?
Yeah. So children with Down syndrome, they tend, like I quickly mentioned earlier, they tend to have low muscle tone, which is something that really can't be changed. Low muscle strength, which you and I know we can change because we can always work out and make our muscles stronger. And they also have differences in sensation. So it's harder for them to feel what's going on in their mouths. It's almost like they have Novocaine in their mouths. And so what we do as professionals is we watch a child eat and we look at them and say, are they eating like I'm eating? And usually the answer is no, because might be coming out. They might be choking on food. They're mismanaging. They're not lateralizing, where their food's going to the back of their mouth. They're not doing these things like we do. So you're looking at their baselines and you're thinking, what could be causing these issues? So we start a little bit of therapeutic intervention with those families to help maybe change food placement or use some different tools that provide different sensory input to help the child to feel what's going on in their mouth a little bit better, so that their muscles fire more accurately. And it's just small things that we can change that make big gains over time. And that's the thing about muscles. It's just like going to the gym. It's like, you look in the mirror and the next week you look in the mirror and you're like, nothing changed, but I did this every day. But then a month later, you look in the mirror and you go, oh, there have been some gains. And that's exactly the same with feeding in a young child or a baby. It's like, it's just consistency over time in using the right strategies per that child. So what I've realized in working with children with special needs and children with this kind of profile and with children with Down syndrome is that most children need this prerequisite kind of muscle activation before they're learning to speak. because if they're not feeling what's going on in their mouth, it's very hard for a therapist to come in and say, watch me do what I do, mama. Because if you can imagine having Novocaine in your mouth and trying to eat something, you and I, we can speak already, but if you can imagine following a direction as a young child and not being able to feel, it's pretty much impossible. So
Yeah.
starting from this baseline area of sensory motor therapy, that's what it's called, sensory motor, oral sensory motor, starting there and helping a child learn to feed, not just functionally, not just food goes in, but properly, where they're managing it correctly, chewing properly, drinking properly. When those things come in properly, then your oral musculature is more ready for speech development. And it totally makes sense. You just can't skip over those basic muscle movements to go straight to speech. So I'm seeing all of my clients, they all have these similar issues coming in. So during COVID, I decided, why don't I teach parents how to help their kids learn to eat more properly? It's so simple. And all it takes is just longevity. And it's just practice over time. And so I started this month-long class where I teach 4 times a month, once a week, for an hour. Parents get on, they ask questions, they learn. It's very interactive. And then they send me videos of their children through the week as they implement these strategies. And so over video, I video back and I say, that was so great. And I tell them, move your hand here, move the food there, try it this way. And I, create these programs specific to their child so it helps them. And then over the month, we learn how to chew, we learn how to sensitize the mouth, we learn how to drink properly. And then with hopes that parent seeks out professionals in their area to help support that further development, and or just continues that really basic program, because some of these things you can continue for months and months and see this very small progress over time that builds into these really big gains.
Absolutely. And, I had the pleasure of sitting in with you on one of your sessions. And I want to say that it's so wonderful to see the footprint of people that you can reach. We had people from Canada all the way to Russia being able to zoom in and access the resources and tools that you were able to provide for their families and their children. So that was really wonderful as well.
It is
And then,
it blows my mind, the people that we reach, whether they're down the street or like you said, like in Russia or Iran, and everybody, it has the same struggles, whether you're next door to me or across the world. And I think that's a really important thing to always remember. And probably the thing that probably my mission and what I've been realizing is that parents need support, and it doesn't have to be it doesn't have to be a lot, but they just need to feel supported in the right way so that they can help their child. They bond with their child, they see progress, they have confidence in, that their child is progressing toward their goals, because that's all they want. And that's all you want as a parent, is to see your child progress.
absolutely. And that's so wonderful. And I know a common term, or at least a term that I've heard buzzing around, is talk tools. I don't know if that's a tool that you utilize on a frequent basis, but if so, are you willing to talk a bit about talk tools and the impact it's had on the way you do your therapy?
Yes. So Talk Tools is a continuing education company, and they teach all of this oral sensory motor education. And if you look them up online, it's talktools.com, and you will find all of the classes that are going on there. They do big conferences, one-off recorded classes. It is the place where I began. So when I started working with the Down syndrome population, and I started saying, okay, watch me do this, repeat after me, mama, and my children couldn't do it. And a year later, mama, and my children couldn't do it. I was like, oh my gosh, I'm not helping this child at all. In fact, I'm failing with this child because I can't get them to do what I want. What's missing? So it was Talk Tools. It was a course that I took. It's their first course. And I took it and it changed my life. And this is something I didn't learn in graduate school. And maybe they're teaching it now, which we're really pushing as a field to get more oral sensory motor work into the curriculum. But if you don't get it, you have to know that there are lots of companies, including Talk Tools, which teach best practices from research base that is oral motor and oral sensory motor. So what I did was I went to this seminar, changed my life, blew my mind, and I started integrating some of these methods into the children that I was seeing, well, little by little. And I saw changes and I integrated more. So what I did was I took lots and lots of classes and I became certified as an instructor over many years. And so that's part of my job today too, is I teach other speech pathologists and as well as teaching parents within this oral sensory motor field. But Talk Tools is a huge domain for so much research, oral sensory motor strategies, and you can also buy tools from them. But it's very important when you look at these big websites that have lots of tools on them, just to know that a tool is only successful with a child if you have a goal in mind. And when you're using it, if it gets you the movement that you're wanting for that goal. So tools can be used in many different ways, but you have to know what you're doing with them and what your goal is.
That's great. That's awesome. It's so wonderful to be able to work your way up to and just continue learning about different ways you can help people who have struggled, or if you feel like you're not making progress, being able to implement the Talk Tools training and some of the Talk Tools devices is really wonderful. And it gives parents alternative resources too, and other things they can use. Like I know we talked about one of their things that vibrates a bit to wake the mouth up to kind of help that Novocaine sort of feeling. So a really, really great program, and I'll be sure to link them below as well. And then one of my last question is a little bit more light. It's, if you could tell the world one thing about your field or about speech pathology in general or about language and communication disorders, what would it be? It can be more than one thing too.
Yeah. Well, the thing that I always say, because the thing that I think is the most important, and I think this probably resonates with a lot of people, is that you don't have to know it all. You just have to have really good intention. And if you have good intention, a family that you're serving will see that. And if you connect with them and their child, they will love you as you learn how to serve their child. And I think that's the best thing to say to, especially to new grads or to people that are just going into the field, because I was so scared even when I got out of grad school, because I felt like, gosh, I don't know everything and I'll never know everything. And I actually chose a specialty so that I don't have to do everything, because it was too much for me. So for me, learning a lot about one thing was the best thing I could have ever done. And I feel like I can really serve families very deeply. But just connecting with a child, a client, a patient is really the starting basis for any type of intervention. And that's the one thing that I would always like to share.
That's beautiful too, because I know as students, at least speaking from my own experience, I'll find myself pushing really hard or just sitting and studying, just trying to cram everything I can in and soak it up like a sponge. But at the end of the day, connection and being, a real human and being able to be passionate and patient and having all those qualities that really do make you a good SLP at the end of the day and a good person per se. And we are all learning. We are all going through a learning experience. Even when you do get your master's and you're a graduate, you can never really learn enough about speech language pathology, in my opinion. So that's a really wonderful remark. I truly love that.
Oh, I'm glad. I live by it. I live by it. You just, you know what you know today, and you don't know, right, what you don't know. So you just do better. You just do better, right?
Absolutely. And then thank you so much again for joining me here today. And then do you want to shout out your business or anything like that?
Oh, well, if you're interested in learning more about what I do or serving people with Down syndrome, you can connect with me easily on Instagram. I like to teach about how to do various things. So eating, drinking, speaking. So you can see all the videos that I post of the children that I serve. And that hashtag is at Happy Kids Therapy. And you're welcome to connect with me at any time. My email is heather@happykidstherapy.com.
Great. And I'll link all of that below as well for anybody watching who might want those resources. But anyway, thank you so much, Heather. I really appreciate your time. It's been wonderful having you.
Yes, thank you so much for having me. This is such a great idea. I hope it changes a lot of people's worlds. I know it will.